We start with questions to the Secretary of State for Health and Social Care. Alice Macdonald.
Question number 1, Mr Speaker.
Who's having it? Secretary of State.
I'm not used to answering the questions, Mr Speaker. Mr Speaker, with your permission, I'd like to take questions 1, 17 and 23 together. First of all, Mr Speaker, can I welcome my honourable friend, the member for Norwich North, to this House and say what an absolute privilege it is to have been appointed as Secretary of State for Health and Social Care. Mr Speaker, we have our work cut out for us. Not only the worst economic inheritance since 1945, for which they should show some more humility, the worst crisis in the history of our National Health Service, which we see reflected particularly in NHS dentistry. 13 million people in England have unmet need for NHS dentistry. That's 28% of the country. And it's disgraceful that rotting teeth is the most common reason children aged between 5 and 9 are admitted to hospital. Shocking. During the general election campaign, Mr Speaker, I pledged to meet the British Dental Association immediately to start conversations on contract reform. And, Mr Speaker, I did exactly that. I'm looking forward to working with dentists and others from across the sector to reform the dental contract and rebuild NHS dentistry.
Alice Macdonald.
Thank you, and can I welcome my right honourable friend to his place. Norfolk is a dental desert and my constituents are suffering. As well as reform of the contract, we need to train more dentists. In East of England, we do not have a dental school. The University of East Anglia has put forward proposals for such a school. Would my right honourable friend meet with me, other honourable members from Norfolk and representatives from the University of East Anglia to discuss this important proposal?
I'm grateful to my honourable friend for her question. It's appalling that Norfolk and Waveney are so poorly served in terms of dentistry. There are only 36 dentists per 100,000 compared to the national average of 53. So when she says that her community is a dental desert, it is the Sahara of dental deserts, Mr Speaker. We will work with partners to ensure patients across the country can access dentists when they need one. I'm aware, not least thanks to her advocacy and the advocacy of other Labour MPs across Norfolk, of the University of East Anglia's proposal, and I'd be delighted to meet with her and my colleagues.
Lewis Atkinson.
Thank you, Mr Speaker. My constituents in Sefton Central tell me that NHS dentistry is broken. It's not just that they can't access routine care, but if they're struck with, for example, excruciating toothache, they can't access urgent appointments either. Can I therefore ask my right honourable friend what steps he's taking alongside the welcome reform of the dental contract to ensure that urgent dental services are available locally in places like Sunderland?
Thank you, Mr Speaker. And I welcome my honourable friend for Sunderland Central. He certainly has big shoes to fill and is a worthy successor to his predecessor. He's absolutely right that alongside contract reform, we need urgent action. That's why we committed to providing 700,000 additional urgent appointments and recruiting dentists to where they are most needed. And I'm delighted to report, Mr Speaker, that dentists stand ready to assist. We're working with the BDA to urgently get those appointments up and running as soon as possible, and we will keep the House informed on progress as we do.
John Pearce.
Thank you, Mr Speaker. High Peak is also a dental desert. We spoke to one practice where they said that they get as many calls for registrations as they do for appointments. Often these calls are deeply distressing, elderly people unable to eat because they need their dentures sorting. I asked the Secretary of State, what first steps is he able to take to cure 14 years of Conservative failure in NHS dentistry?
I'm grateful to my honourable friend for that question, and I welcome him to the House. He is absolutely right to point out that these challenges have been 14 years in the making, Mr Speaker, and it will take time to fix the damage that the Conservatives have done to our National Health Service. We will start with 700,000 urgent appointments, as we promised. We will continue with contract reform, which is essential. And I want to reassure my honourable friend that as we do, we will have the needs of all communities in our country at heart, particularly rural communities like his, which have particular challenges. And I look forward to involving him and keeping him up to date on the progress as we make it.
Then Harriett Baldwin.
Thank you, Mr Speaker. The NHS Dental Recovery Plan was launched earlier this year, and he has on his desk the impact that that's having. Could he share with the House how much that's increased appointments in the Worcestershire and Herefordshire ICP area, please?
Secretary of State.
Mr. Speaker, I must say the party opposite lauded this plan during the general election, and I think the public delivered their verdict on the progress they made at the general election. NHS dentistry is non-existent in huge parts of the country, Mr. Speaker. There were aspects of the previous government's dental recovery plan which we will stick with because they're the right solutions. There are other gimmicks, Mr. Speaker, which we will not proceed with, and we will come forward, as I've stated, with a serious plan to reform the dental contract, something they committed to do in 2010 and failed to do in every single year in the 14 years they had to do it.
Layla Moran.
Mr. Speaker, I've got a constituent who has been trying to get a dentist appointment for a year. They've got painful abscesses, they can't sleep, and they can't eat out of the right side of their mouth. We need to get on with this. Now, I note that there has been a review launched of the NHS, but the British Dental Association is concerned that that review will delay the changes to NHS dentistry that are so desperately needed. So would the Secretary of State please give us a timeline? When can we see change?
I'm grateful to the honourable member for her question and congratulate on her re-election to the House. She's right to point to the detrimental impact that the Conservatives' failure is having on people's lives. In fact, in 1948, when the National Health Service was founded, Nye Bevan received a letter from a woman who'd worked her entire life in the Lancashire cotton mills about how the dentures she was given by that National Health Service had given her her dignity and her freedom to associate in any company. What a tragedy that 76 years later, the party opposite squandered and destroyed that legacy to the point where people are suffering in pain and agony, yes, but also suffering the indignity of not being able to find a job, not being able to socialise in polite company because they are ashamed of the state of their rotting teeth. She's absolutely right. Lord Darcy is doing a review on the state of the NHS, which we will report in September. That is not preventing us making progress, talking to the BDA and working within the department and across the sector to get those 700,000 appointments up and running as a matter of urgency. And I look forward to reporting progress to her and other honourable and right honourable members.
Joe Robertson.
Thank you, Mr. Speaker. As the right honourable gentleman is aware, there's a particular shortage of NHS dentists in coastal and rural communities, like in constituencies such as mine on the Isle of Wight. Will he therefore today commit to the previous government's plan for 240 golden hellos for newly qualified dentists by the end of the year to address this issue?
Mr. Speaker, he's absolutely right, and firstly, welcome him to the House. It's a rare thing to welcome new Conservative members, and he is welcome. Mr. Speaker, he's absolutely right to touch on the workforce issues in NHS dentistry, and absolutely right that we need to incentivise dentists on two fronts. Firstly, to commit to the NHS and do more work in the NHS. There are a range of things we're looking at in that regard, but also to make sure that we get new dentists to the areas where they are most needed, and we will certainly support incentives to that effect.
Shadow Minister Saqib Bhatti.
Thank you, Mr. Speaker. I welcome the Right Honourable Member and his new team to their place in the department. But when my Right Honourable friend, the new Shadow Secretary of State was Health Secretary, she prioritised access to care. This included NHS dentistry, with a dental recovery plan that she launched, announced new dental vans to provide access to care to our most rural and coastal communities in England. We had agreed with NHS England that the first vans would be on the road by this autumn, and I know that this timescale was welcomed by colleagues across the House. Will the Right Honourable Member now confirm that dental vans will be on the road by this autumn?
Secretary of State.
Mr. Speaker, I couldn't have picked a better example of the desperately low ceiling of ambition the previous government had than the fact that they laud, after 14 years, their triumph of dental vans roaming the country in the absence of actual dentists and dental surgeries. What an absolute disgrace. Now, I accept that the Shadow Secretary of State for Health and Social Care was just the last of a very long list of health and social care secretaries who had the chance to fix the problems. It wasn't all on her, and it's important I say that, not least because of the leadership elections that will be taking place opposite soon. But I just say to the Shadow Minister, and I congratulate him on his appointment, He sat behind Secretaries of State as their parliamentary private secretary year after year, week after week, looking at the utter abysmal failure of their record. When it comes to criticising this government on actions we will take, they don't have a leg to stand on.
Steff Aquarone.
Mr. Speaker.
Minister.
Thank you. I thank the honourable gentleman for his question and welcome him to his place. A staggering 13 million people are unable to see a dentist thanks to what the party opposite have done to NHS dentistry over the last 14 years. Now, I know that the honourable gentleman represents the constituency that has the lowest number of dentists per head in the entire country. Our rescue plan will provide 700,000 more urgent dental appointments and recruit dentists to areas that need them. We will rebuild the service for the longer term through reforming the dental contract.
Thank you, Mr. Speaker. In North Norfolk, as you've alluded to, my honourable friend, we've suffered in particular from unallocated units of dental treatment being moved to other parts of the country. The ICB has been told it will have to return unused money this year back to the Treasury. Can he commit to protecting unallocated dental funds in my constituency?
I thank the honourable gentleman for that question. As my right honourable friend, the Health Secretary, stated, the Monday after the general election, he was meeting with the BDA to look at a whole range of issues around the long-term NHS contracts. That is an ongoing dialogue, including UDAs, of course, and we need to ensure that we have the negotiations rapidly. We will work at pace to address some of these long-term issues. But let's not forget that the party opposite allowed the NHS contract to atrophy and took NHS dentistry to the brink of collapse in our country.
Claire Hazelgrove.
Thank you, Mr. Speaker, and may I congratulate the my right honourable friend and his fantastic team on taking their new place on this side of the chamber. May I also thank my right honourable friend for his advocacy for people across the Filton and Bradley Stoke constituency when it comes to a lack of dental access in the last Parliament. Now, may I ask my right honourable friend what assurances he can provide in terms of linking together the important issues of infrastructure and housing. So, as we look to build those 1.5 million much-needed homes across the country, making sure that we don't have more dental deserts, making sure that we have the infrastructure we need is vital. So, can I ask my right honourable friend how he'll be working in a cross-departmental way to ensure that we achieve this?
Minister.
I thank my honourable friend and warmly welcome her to her place and congratulate her on her election. The key aspects of our dental rescue plan will include 700,000 more appointments through extra funding that we will generate through cracking down on tax dodgers and closing other loopholes. We're going to incentivise new graduate dentists to come to the areas that are underserved to ensure that we are plugging the gaps and there'll be golden hellos to make that happen. We're also working hard on things like supervised toothbrushing for 3 to 5-year-olds because prevention is always better than cure.
Leicestershire.
Question 3.
Minister.
Thank you, Mr. Speaker. And can I congratulate my honourable friend on his re-election? And he will know that capital allocations are a matter for the integrated care boards. We are committed to introducing neighbourhood care centres to bring together vital care services, and I look forward to working with him on Labour's missions to improve the front door to the local NHS.
Bill Leicestershire.
Well, thank you. Can I congratulate my right honourable friends on their appointments? My right honourable friends' predecessors, and there have been quite a few of them in the last few years, all agreed with me that a health centre in Maghull in my constituency was a priority for the health service. But as my honourable friend has just said, the allocation of capital by integrated care boards has meant that priority has gone to acute hospitals, sometimes at the expense of community facilities. So can I ask her to meet with me to discuss the importance of investment in health centres like the one in Maghull that will make such a difference to reducing the waiting times in the NHS and improving patient outcomes?
Well, he is first out on the blocks on this and has shown his commitments to improving primary care for his constituents. And I'm sure the local ICB are listening very carefully to that, because we do know that the existing primary care estate is under a great deal of pressure. That's why building a neighbourhood health service remains at the absolute forefront of our mission to rebuild the NHS, and I'm absolutely pleased to meet with him on that.
Adam Jogi.
Question 4, Mr Speaker.
Minister.
Can I start by warmly welcoming my honourable friend, the new member for Newcastle-under-Lyme, and thank him for raising this important issue. The UK Health Security Agency works with the regulator, the Environment Agency, to advise on health risks from landfill sites. In relation to the one in his constituency, UKHSA undertakes monthly risk assessments using air quality data. A multi-agency group, including government agencies and local authorities, meet regularly to review the situation and interventions needed. I will, of course, raise with my counterparts in the Department for Environment, Food and Rural Affairs his concerns.
Adam Jogi.
Thank you, Mr Speaker, and I thank the Minister for his answer and welcome him to his place. Now, Mr Speaker, Wally's Quarry landfill in Newcastle-under-Lyme is an environmental crisis and a health one too, and my constituents, Sheila Casey-Hume, Jan Middleton, Lee Wolford and many, many others, are rightly scared and angry about the impact of toxic levels of hydrogen sulphide on the health and well-being of local people. Will the Minister come to Newcastle-under-Lyme to listen, to learn and to smell, and to finally help us stop the stink?
Mr Speaker, public health and prevention is a priority for me, and it is a priority for this Labour government. Obviously, the Environment Agency takes the lead in this specific instance, but I am more than happy to jump off the train at Stoke, if he'll pick me up, and visit my honourable friends' constituents to listen to their concerns and to ensure that public health considerations are amplified to Environment Agency colleagues.
Dr Neil Shastri-Hurst.
Question number 5, Mr Speaker.
Minister.
I thank the honourable, learned and gallant member for his question. Over 500,000 fragility fractures occur every year, and up to 40% of fracture patients will suffer another fracture. I praise the campaigns by the Sunday Express, Mail on Sunday and the Royal Osteoporosis Association for their campaigns on this. I am pleased to reiterate the government's commitment to expanding access to fracture liaison services. The department are working closely with NHS England to develop plans to ensure better quality and access to these important preventative services.
Dr Neil Shastri-Hurst.
Well, firstly, may I congratulate the Minister on his appointment and the rest of the front bench team. As a former orthopaedic surgeon, I'm mindful of the impact of osteoporosis on many of our constituents, including my own in Solihull West and Shirley. In England, more than 67,000 people suffer from a fracture every year. A disproportionate number of those are women. What we do know, however, is that fracture liaison services, where they're delivered well, can prevent many of those fractures. Currently, half of the country has access to such services. The last Conservative government made a commitment to roll out that to the whole country by 2030. Will the Minister honour that commitment?
The member makes a really important point here, and this is something that we are absolutely committed to ensuring that the services across England are better than those which we have inherited. Of course, I completely agree with the honourable gentleman about the need to improve these services in specific parts of the country. That's something that we will be looking at in detail. But I do have to say to the honourable gentleman, the one thing we won't be doing on this side of the House is what he has written in Conservative Home about, and that is health rationing and cutting back on treatment.
Moran.
Question number 7.
Minister.
Thank you, Mr. Speaker. Can I congratulate my honourable friend on her election, and can I also pass on my best wishes to her and her husband, who I know recently suffered a stroke. We hope he makes a speedy recovery, and we also recognise the great work of NHS staff for them, and indeed all our constituents every day. But we do know that the NHS is broken. The latest data confirms the terrible state in which the Conservatives left urgent and emergency care services, with 1 in 4 patients waiting longer than 4 hours in A&E. That's why Professor Lord Darcy will lead an investigation into NHS performance, and the findings will inform our 10-year reform of the NHS.
Macdonald.
Thank you, Mr. Speaker, and I thank the Minister for her kind words today. I also want to thank my right honourable friend, the Health Secretary, for his wishes on the day. And Mr. Speaker, may I also take this opportunity to thank you and your staff for the care and kindness that you showed me. Mr. Speaker, residents in my constituency of Stratford-in-Bow are served by Bart's NHS Trust, which includes Newham University Hospital, Royal London and Whipps Cross Hospitals. In May, their A&E departments had the second highest volume of any trust in England and the highest in London. Overcrowding and capacity constraints means staff at these hospitals are having to treat some patients in corridors rather than on wards. This is the broken NHS that we have inherited from the Conservatives. Will the Minister ask her department to look at capacity issues at these hospitals and how community pharmacist prescribing services may be used to alleviate some of the pressures?
Thank you. But she makes an excellent point highlighting the challenges, particularly around hospital capacity, something is well known on these front benches with my right honourable friend in the same area. The type of patient experience is unacceptable but has sadly become normal under the last government of 14 years, and she makes an excellent point about pharmacies. They will be central to the role in our future system, and of course I'm very happy to undertake a visit with her.
Priti Patel.
Thank you, Mr. Speaker. May I welcome the new front bench to their new portfolios and responsibilities. Over the last 14 years in Essex, we've actually seen some improvements in our emergency care services, particularly with our ambulance trust, and that is something that should be commended. But one of the ways in which emergency services or pressure on emergency services can be reduced is by having community facilities in our towns and across our districts. So would the Minister commit to meeting with myself and working with my right honourable friend, the member for Malden, on looking at the way in which we can safeguard community services at St Peter's Hospital in Malden, which is something our communities absolutely need?
Well, can I thank the right honourable lady, because she makes again for us the excellent point about what's happened in the last 14 years under her government, that these situations have been allowed to get so much worse, both in Essex and across the entire country. But she is also, I welcome the fact that our mission to rebuild the broken front door to the NHS, have more neighbourhood services based in communities, bringing those services together where patients are, is absolutely what we want to see, and I'm very happy to discuss that with her.
Sean Davis.
Mr. Speaker, for 14 years, myself and the community in Telford have worked hard to safeguard our A&E in Telford. But the last Conservative government made Telford the largest town without a fully functioning A&E. Will the health team meet with me and other Shropshire MPs to discuss this discredited and disgraceful decision?
Minister.
Well, again, can I welcome my honourable friend to his place? And he knows what, in fact, we all know, what the entire country knows, because we spent the last 6 weeks campaigning around the country, that across the country it's the same story. That's why we've committed to restore standards, and that's why we will fix this broken NHS. And of course, I'm happy.
George.
Thank you, Mr. Speaker. The urgent treatment centre at the West Cornwall Hospital in Penzance was closed under the Conservatives at night 2 years ago. And this has put pressure on Cornwall's only emergency department at Treliske, a long peninsula, where routinely 20 ambulances, blue light ambulances, are parked outside, creating a new metallic ward at the front of the hospital. I mean, that situation has had a detrimental impact, and of course, including avoidable death. Will the Minister meet me and colleagues to discuss this issue, and with local NHS, to see how we can restore the emergency services in the area?
Again, across the country, we see the damage that the last 14 years have done, and he's absolutely right to highlight that one part of the system knocks onto the other part of the system. That's why we want to have a long 10-year plan to look at this, an immediate look with Lord Darcy, but critically to understand what community and primary care services can be supported to support the rest of the system. I'm very happy to meet with colleagues across Cornwall. We now have many Labour MPs across Cornwall as well, so I'm very happy to discuss that with you.
Question 8.
Minister.
Well, I thank the honourable gentleman and congratulate him on his survival instincts by getting re-elected to this place. NHS dentistry needs urgent action, thanks to 14 years of the chaos, failure and neglect that we've seen. Our rescue plan will get NHS dentistry back on its feet, followed by contract reform to make NHS dentistry more attractive. A consultation for a tie-in to NHS dentistry for graduate dentists closed on the 18th of July, and we are now considering the responses. The government's position on this proposal will be set out in due course, and I will keep the House updated on this matter.
George Freeman.
Well, can I thank the right honourable gentleman, my honourable friend, for that answer and congratulate him and his colleague Secretary of State on their appointment. All of us who are serious about the health service and about the need for reform, about which Secretary of State has spoken, have your back in pushing for reform. And could I gently, he has his moment of triumph, but gently encourage him to reach out and build a cross-party coalition of support for serious reform. The NHS is broken not by Tory cuts, but by years. We've been pouring money in. It needs to modernise for the 21st century. In the spirit of which, on dentistry, could I encourage the front bench to reach out and have a meeting, a rainbow coalition meeting of the new member for Norwich North, Norfolk and myself, all MPs in Norfolk, which has suffered more than most counties. We desperately need that UEA dental school.
Give you a new script.
Well, I thank the honourable gentleman. He was doing so well at the start, and then he kind of blew it there a bit towards the end. But look, it's absolutely right that we put country before party. And we will work with whoever has the best interests of rebuilding our public services at heart. The issue that he raises specifically sounds interesting. What I would say is that unless we get the bigger picture sorted, unless we make NHS work pay for dentists, then we're not going to be able to rebuild the NHS dentistry system that we should be cherishing and seeking to reform. But of course, I'm always open for conversations with the honourable gentleman.
Thank you, Mr. Speaker. Just 39.2% of my constituents were able to access an NHS dentist over the last 2 years. That's an absolute disgrace. But the Health Select Committee put together a report into NHS dentistry, setting out a blueprint of how to resolve the challenges, including access, looking at tie-ins as well as ensuring that we get more dentists registered. Will he look at that report and follow the recommendations of the report?
Minister.
Well, I thank my honourable friend and congratulate her on her re-election. It's wonderful to see her back in her place. Absolutely right that the tie-in consultation, the deadline was the 18th of July. We are considering those responses, but certainly with an open mind on that. And with regard to the broader issues that she mentions, well, of course, our rescue plan is 700,000 more appointments, incentives for new graduates to go to underserved areas, reform of the dental contract, making work pay for dentists, and that, I think, is at the heart of the reforms that she mentioned, and that is what we will be doing.
Ahmed Yazin.
Number 9, please, Mr. Speaker.
From bench, who wants it?
Very sorry. With your permission, Mr. Speaker, I will answer questions 9 and 20 together. May I congratulate my honourable friend, the member for Bedford, on his re-election, and my honourable friend, the member for Macclesfield, on his election. Over 1 million people with mental health issues are not getting the support they need. This government will fix our broken NHS. This will include recruiting 8,500 mental health workers, including specialist mental health professionals in every school, and rolling out Young Futures hubs in every community. And as announced in the gracious speech, we're bringing forward legislation to modernise the Mental Health Act, a hugely significant step that's been warmly welcomed by service users, campaigners, and indeed by the former Conservative Prime Minister, Theresa May.
Ahmed Yazid.
I thank the Minister for his answer and welcome him to his place. Funding to bring desperately needed inpatient mental health services back to Bedford has been sitting in the account of our local mental health trust for years, but can't be used because of the previous government's capital expenditure limits. So will the Minister meet me to discuss a way forward to get this urgently needed mental health facility back in Bedford, so that my constituents don't have to travel miles to access this very vital service?
Well, I thank my honourable friend for that question. I know he's been campaigning with great passion and conviction on this issue for some time, and I'm in no doubt that his ICB will have listened very carefully to every word that he just said today. I would, of course, be very pleased to meet with him so that we can discuss this matter in greater detail.
Tim Rocker.
Thank you, Mr. Speaker. The Prime Minister has been clear that the government will make, unlike its predecessor, evidence-based policy. Whilst the NHS has made some high-level progress, waiting data for those waiting for mental health elective care remains unacceptably high, but also incomplete. Does he agree with me that comprehensive data is absolutely crucial if we're to serve the patients that we care about?
Well, I thank my honourable friend and welcome him warmly to his place, and I hope he won't mind if I use this analogy, which is you can't make a prescription unless you have the diagnosis, and you cannot make policy on the hoof. You can't have the chaos and neglect and failure that we've seen from the party opposite for the last 14 years, because they haven't made a policy based on evidence and data. So I'm absolutely on board with that and would be more than happy to discuss it with him further at his convenience.
Richard Holden.
Thank you very much, Mr. Speaker. And I welcome the opposition front bench to their roles and the government front bench to their new roles as well. One of the things that we did very well I think over the last few years on a cross-party basis, actually recognise tackling that disparity between mental health and physical health. And since 2018, £4.7 billion extra has gone into the NHS mental health services. I just wondered if the government will be able to commit to that going forwards and ensuring that proportion of funding towards mental health services will increase in the coming years.
Minister.
Well, I thank the honourable gentleman for his question, but he appears to be living in a parallel universe, because we are in the midst of a mental health crisis in our country, and that is the result of 14 years of Tory chaos, neglect and failure. We have a plan, 8,500 more mental health workers, Young Futures walk-in hubs, specialist mental health for support for young people, mental health specialists dealing with talking therapies, and of course we're going to bring forward legislation through the gracious speech to deal with helping people who have more severe conditions. So that, I think, is a plan of action that I hope, can make our country once again proud of how we're dealing with this extremely serious issue.
Sorry, Dyke.
Mental health pressures in the farming community are rising, with the Farm Safety Foundation survey finding that 95% of farmers under 40 agreed poor mental health is the biggest hidden problem facing the industry today. So will the Minister work with colleagues in DEFRA to improve access to the NHS mental health services in rural areas and support the continued rollout of rural health hubs?
Minister.
Well, I thank the honourable lady, and that's an extremely important question that she raises. We are indeed looking at that issue through our 10-year plan for the future vision of our health service. Issues around isolation, issues around huge pressure on what are often family businesses are really creating tremendous strains for this community. We take that very seriously, and we will of course be working with our colleagues in DEFRA to address it.
Shadow Minister Dr Ben Spencer.
Thank you, Mr. Speaker, and may I congratulate the government front bench on their appointments. And I should declare that I am a former NHS consultant psychiatrist. My wife is an NHS doctor, and I participated in the Wesley Mental Health Act review. And while I no longer have a licence to practice, I may gently correct the Minister in that it is possible to provide a prescription without a diagnosis. Now, we are pleased that the government intends to build on the work of Conservative governments, kick-started by the former member for Maidenhead, to reform the Mental Health Act, and we will work constructively with them to make this legislation effective, fair and compassionate as possible. With that in mind, does he intend to make changes to the Code of Practice to the Mental Health Act now, so that non-statutory changes and protections can be enacted while the bill works its way through Parliament?
Don't worry, Minister. Don't worry.
Well, I welcome the Shadow Minister to his place and congratulate him on his appointment. It is a little bit rich to be receiving a question like that, given that they've had 14 years to address this issue. I've been in this position for 16 days, so, but I think that if you look at the plan that we're bringing forward, the Honourable Gentleman will see that we've got more ambition and more boldness in our plans than what we've seen in the last 14 years. We will, of course, be bringing forward legislation that will address these extremely important issues for people who have got some of these more severe conditions. To his specific point on a code of practice, I think the first step will be to see the legislative process moving forward. But of course, we remain open to looking at any solution or reform that is going to help to address this extremely important issue.
Catherine Smith.
Number 10, Mr. Speaker.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. It's painfully clear that the previous government's new hospital programme that said they would deliver 40 new hospitals by 2030 is not deliverable in that time frame. I want to see the new hospitals programme completed, but I am not prepared to offer people false hope about how soon they will benefit from the facilities that they deserved. That's why I've asked officials, as a matter of urgency, to report to me on the degree to which the programme is funded, along with a realistic timetable for delivery. We will not play fast and loose with the public finances, nor will we play fast and loose with people's trust, as the previous government did.
Cat Smith.
Thank you, Mr. Speaker. Lancaster's Royal Infirmary is at capacity. It was a Victorian-built hospital. I'm sure it was cutting edge back then, but the reality is now it is not fit for purpose. Yesterday, the Joint Investment Strategic Committee expressed its support for the new build scheme in Lancaster, so it will soon be on the Secretary of State's desk. Will my honourable friend commit to meeting with me and other interested local MPs in North Lancashire to ensure that after 14 years of chaos under the Conservatives, it's a Labour government that delivers the new hospital for Lancaster?
And the hospital for...
Well, I was about to say, Mr. Speaker, that the good people of Lancaster and Wyre will be delighted to have sent her to Parliament, because she is second only to you, Mr. Speaker, in collaring me about a local hospital project. You indeed are the holder of that record. And look, there's a serious point here, which is thanks to her determined efforts to collar me around the parliamentary estate. I know that there is a particular urgency around land. There is a scheme that will be put to me shortly. I will consider that carefully and look at the programme in the round and make sure that I'm able to come back to this House and back to the country with promises that we can keep and promises the country can afford.
James Wilde.
During the general election campaign, Labour said it was, and I quote, committed to delivering the new hospitals programme, including modernising QEH and Kings Lynn to address its potentially dangerous RAC. So will the Secretary of State honour that pledge that was made to my constituents and to the staff at QEH and approve the business case submitted by the Trust for the new multi-storey car park that is a key enabling project for the new hospital we need by 2030?
Secretary of State.
Well, Mr. Speaker, can I firstly say that when it comes to RAC hospitals, they are top of my list of priorities. I'm extremely concerned about the dire state that the NHS estate is in. I do, once again, think it is a bit rich for members opposite, whose government was in office only weeks ago, where they literally had a Prime Minister local to that particular hospital. They didn't do it when they had the chance, but don't worry, we'll clean up their mess.
Shadow Minister Dr Curran-Johnson.
Thank you, Mr. Speaker, and I congratulate the Right Honourable Gentleman on his position. I should declare that I have been working in the NHS for 23 years, currently as a NHS consultant paediatrician, and I look forward to using this experience in my new role as Shadow Minister of State, scrutinising constructively the government. Under the new hospital programme, the previous government had already opened 6 hospitals to patients, 2 more due to open this financial year, 18 more under construction. The government are now putting this at risk by launching a review of this work, delaying those projects which are of vital importance to patients across the country. Can the Right Honourable Member please confirm when this review will be completed?
Minister,
Mr. Speaker, firstly, can I welcome the Honourable Lady to her new post. I must say I preferred her much more as a backbench rebel than a frontbench spokesperson, but I do have enormous respect for her years of NHS contribution and the experience that she brings to this House, and I always take her seriously. However, on this one, I would just once again say to the party opposite that they handed over an entirely fictional timetable. Entirely fictional timetable and an unfunded programme. And she might not know it because she wasn't there immediately prior to the election, but the Shadow Secretary of State sat right next to her, knows exactly where the bodies are buried in the department, knows exactly where the unexploded bombs are, and know exactly the degree to which this timetable and its funding was absolutely not as it was set out by the previous government.
Person Daisy Cooper.
Thank you, Mr. Speaker. I'd like to welcome the Secretary of State and his ministers to their role. But I would just like to gently warn the Secretary of State that if he intends to run a contest on which member can harangue him the most on a crumbling hospital, that is a challenge to which our 72 Liberal Democrat MPs say challenge accepted. Under the Conservatives, the new hospital programme has absolutely ground to a halt. And we know the terrible stories of nurses that run bucket rotas and all the rest. We have the worst of all worlds at the moment. There are trusts such as mine in West Hertfordshire who are chomping at the bit to get going but can't and are being held back. There are other trusts that have capital funds that they want to spend but they're not allowed to because of outdated rules. And of course there are industry concerns that with just one top-down centralised approach, which the Conservatives had, that could decimate the competition in that industry when we need a thriving industry to rebuild our hospitals and our primary care. What is his response to that approach?
Firstly, can I welcome my honourable friend back to her place. We work constructively when we're on the opposition benches together, and regardless of the size of the majority on this side of the House, we intend to work constructively with her this side of the election too. By extension, can I congratulate her colleagues on their election? I have discovered, Mr. Speaker, I have 72 new pen pals, and they are all sat there on the Liberal Democrat benches and have been writing to me about a whole manner of projects, and I will, myself and my colleagues will get back to them. But she is right. This isn't just about the new hospitals programme, important though that is. The condition of the whole NHS estate is poor. In fact, backlog maintenance, with the direct cost of bringing the estate into compliance with mandatory fire safety requirements and statutory safety legislation, currently stands at £11.6 billion. That is the legacy of the last Conservative government.
Ribeiro Addy.
Please, Mr. Speaker.
Thank you, Mr. Speaker. And can I congratulate my honourable friend on her re-election and thank her for raising this important issue. It is not right that 3 out of 4 parents are not able to stay with their critically ill baby overnight at such an important point in that new relationship. NHS England have recently concluded a review of neonatal estates. They are in the early stages of analysing the findings which will be used to inform the next steps, and we are all determined to support parents to be involved in every aspect of their baby's care.
Ribeiro Addy.
Thank you, Mr. Speaker, and I congratulate my right honourable and honourable friends on their re-elections and taking up the places. Mr. Speaker, recent research from the charity Bliss showed that when a baby receives neonatal care, their parents are routinely expected to leave them in hospital overnight for weeks or even months at a time. Their research found that for every 10 babies that need to stay overnight in neonatal care, there's only 1 room available for a parent to stay with them. So how will the Minister ensure that the existing guidance about facilities for families is followed, and how will she ensure that the Trust can access the resources they need to stop this separation of babies and their parents?
Well, she is absolutely right. The separation of babies and their parents at that time is not acceptable, and the shocking state of the estate, as we have just heard. We will look at those findings from the NHS review very, very, very quickly. I'm very happy to come back to her on those specific points.
Jim Sherman.
Thank you, Mr. Speaker, and thank the Minister for her answer. Minister, quite clearly the issue isn't just accommodation. The issue is also physical and emotional help for those parents who have been through, mothers who have been through very traumatic emotionally and physically circumstances. Can I ask what would be done along those lines to ensure that mothers have all the help and the babies as well? Thank you so much.
He absolutely makes a really important point about the mental health support around that critical period, and we will absolutely make sure that's looked at as part of that.
John McCall.
Question 12, Mr. Speaker.
Minister.
Can I thank my honourable friend, the member for Banbury, 2 words that I didn't think I would ever say, and welcome him to his place. The answer to his question is yes. But we don't just want to discuss with patients and staff, we want them to help shape the 10-year plan for the next decade of reform that will take our NHS from the worst crisis in its history and make it fit for future. Social care also needs to change. We will work with care workers and care users to build consensus for and shape a new national care service.
Wilcott.
Thank you, Minister. And
Mr. Speaker, the question I would follow up to that is whether he agrees with me that the voice of frontline staff, whether it's in hospitals like the Horton Hospital in Banbury or carers like my mum, is still often ignored when it comes to whistleblowing. And more worryingly, these voices are silenced by threats of reporting them to regulatory bodies. Does he agree with me that we need to level the field of accountability when it comes to managers who ignore whistleblowers, and should there be a regulatory body with oversight of medical managers?
Minister.
My honourable friend is absolutely right. We've previously said that bank managers are more regulated than NHS managers. This Labour government will pursue an agenda of greater accountability, greater transparency and candour when it comes to those making managerial and executive decisions in our National Health Service.
Mr. Speaker, integrating health and social care is vital to take the staff component along with you. It's also vital to have sufficient funding. Now, we integrated health and social care in Scotland in 2012, and it's been a difficult road. But health in Scotland is funded £323 per head more than it is in England. Will the Minister commit to put his hand in his pocket and make sure English people enjoy the same funding of health as people in Scotland?
Minister.
I welcome the honourable gentleman back to the House, but I would politely say to him he needs to be a little bit patient. There will be some announcements in the near future on this government's plans for social care, and he should rest assured we on these benches understand the integration agenda. We understand the need to fix both the NHS and social care, and this Labour government will do that.
Shadow Minister Sir John Whittingdale.
Can I congratulate the honourable gentleman and his front-bench colleagues on their appointment and welcome the suggestion that the government is considering the possibility of a Royal Commission on social care and to address this issue on a cross-party basis. But that will take time. And can he therefore confirm, as was suggested during the election campaign, that the government will take forward the Dilnot reforms, and in particular that they will introduce the cap on social care costs as was planned by the previous government?
Minister.
Well, of course, it was his government that kicked the can down the road on these issues. The transformation money that was given precisely for the Dilnot reforms, they allowed the system to spend on fixing their broken National Health Service. The right honourable gentleman should just be a little bit patient. We will announce in a short period of time our proposals for social care, but he should rest assured, as I've said to the honourable gentleman previously, this Labour government is determined to fix both the broken NHS and the broken social care system that we inherited from 14 years of Tory failure.
Liberal Democrat spokesperson Daisy Cooper.
Thank you, Mr. Speaker. Liberal Democrats spoke about care a lot during the general election. At the heart of our plans was our pledge to introduce free personal care. Could ministers please confirm whether or not they do intend to open cross-party talks with other parties, and if so, whether free personal care will be on the table as one potential option?
Minister. Can I thank the honourable lady for that question, and indeed for the way that the Liberal Democrats approached the issue of health and social care in the general election. As my right honourable friend, the Secretary of State, has already said, we will work with all in this House that want to fix our broken health and social care system. Of course, we will work collegiately across party in our approach, and of course, all issues in relation to how we fix our broken social care system will be discussed during the deliberations across party.
We're going to Topicals. Caroline Harris.
Thank you, Mr. Speaker. During the free NHS... Question one.
Secretary of State.
Thank you, Mr. Speaker. Our NHS is broken. This government has been honest about the problems we face because we're serious about fixing them, and we haven't wasted a moment appointing Lord Darcy to carry out an independent investigation into the state of our NHS, resetting the relationship with junior doctors with negotiations starting today, laying the foundations to deliver 40,000 more appointments a week to cut waiting lists, the gracious speech kick-starting a decade of national renewal with modernisation of the Mental Health Act and reform on smoking to make sure that this generation of young people is the first smoke-free generation, the first step to making sure that generation is the healthiest generation in history.
Caroline Harris.
Thank you. Brain fog. During their free NHS 40-plus health check, women are assessed for conditions that may affect them as they grow older. Menopause, however, is not included. To include it would be cost neutral and would help millions of women not only recognise the symptoms, but would also prevent needless GP appointments going forward when these symptoms start to develop. I and Menopause Mandate have been campaigning tirelessly on this issue. Will the Secretary of State please look at this matter urgently?
I'm delighted to see my honourable friend back. She campaigns relentlessly on this issue, and it would be very risky for me to do anything other than to agree to meet with her, because I agree that progress needs to be made on this vital issue.
The Secretary of State, Victoria Atkinson.
Thank you, Mr Speaker. May I welcome the Right Honourable Gentleman and his ministerial team to their places and wish them well in their endeavours. And with your indulgence, Mr Speaker, I'd like to place on record my thanks to my superb team of former ministers, to Private Office and officials in the department for their hard work and support, as well as the doctors, nurses and social care and health professionals I've had the pleasure of working with. Now to business. In opposition, the Right Honourable Gentleman described the 35% pay rise demand by the Junior Doctors Committee as reasonable. What he didn't tell the public was that this single trade union demand will cost an additional £3 billion, let alone the impact on other public sector workers. So will he ask the Chancellor to raise taxes, or will she ask him to cut patient services to pay for it?
Can I welcome the Shadow Secretary of State to her new position and say that she has, in the way she opened, behaved in her typically graceful and decent way, and I enjoyed working with her on that basis and will continue to work with her on that basis. Now, although I must confess, Mr Speaker, when I heard about the abominable behaviour of the Shadow Health Secretary, I thought, what on earth have I done now? And then I realised, actually, the roles have swapped and it wasn't me they were referring to. Look, I just say on this, what I said was that the doctors were making a reasonable case that their pay hadn't kept up in line with inflation, but we were clear before the election that 35% was not a figure we could afford. We are negotiating with junior doctors in good faith to agree on a settlement that we can deliver and the country can afford.
Victoria Atkins.
I'm afraid I don't like it when Secretaries of State don't answer questions, and I'm sorry to see that he gave another non-answer, as has been the case of the front bench this time. But this is a question I hope he will be able to answer. The final act of the Conservative government was to protect children and young people by banning private clinics from selling puberty blockers to young people questioning their gender. Will the Right Honourable Gentleman confirm that he will resist the voices of opposition on the benches behind him and implement in full all of Dr Cass's recommendations, including exercising extreme caution, as she said, in the use of cross-sex hormones in young people, because they and their parents deserve certainty from this government?
On this, obviously, there is a judicial review on the former Secretary of State's decision, which I am defending, and that matters sub judice, and I'll steer clear of it. So just to go back to first principles, Mr Speaker, we are wholeheartedly committed to the full implementation of the Cass review, which I think will actually deliver material improvements in the well-being, the safety and the dignity of trans people of all ages, and I think that's important. And let me just say, Mr Speaker, I want to reassure LGBT+ communities across the country, particularly the trans community, that this government seeks a very different relationship with that community. I look at the rising hate crime statistics, I look at their struggles to access healthcare, and I look at their desire just to live freely and equally and with dignity, and that is what we will work with them to deliver.
Order. Can I say to future front bench question, I understand today's a new start. We have to be short, we have to be speedy. That's the whole idea of these questions. Otherwise, members aren't going to get it. Savia Cole.
Number 2, Mr Speaker.
Question.
Sorry. Thank you, Mr Speaker. After 14 years of Conservative mismanagement of our NHS, waiting lists at Southampton General Hospital in my constituency is close to 60,000. I welcome my Right Honourable friend's commitment and plan to bring down waiting lists, but can he also outline what support will be offered to those waiting for treatment, many in pain, as we tackle the shameful backlog we inherited.
I mean, she makes an excellent point about the stress of waiting on particular people. We've talked about the disaster of the last 14 years, but they're waiting, stressful, with potentially deteriorating conditions, and we absolutely need to address this issue as part of our work to reduce those waiting lists.
Thank you, Mr Speaker. The Government has announced ambitious house-building targets, but the Labour Party manifesto, so far as I could tell, was silent on the GP estate upgrades. Does the Minister agree with me that the Conservative policy to build or refurbish 250 GP surgeries in England is a sensible policy to implement?
I'm proud that the Deputy Prime Minister will be delivering the commitment to deliver 1.5 million new homes. It is absolutely vital that the infrastructure that's needed goes alongside those new homes, and we'll be working very closely with the Deputy Prime Minister, as other colleagues will be across government, to make sure that the social infrastructure is also provided.
Rutland.
Speaker, last week Worthing Hospital came close to having to consider downgrading its maternity services due to a shortage of specialist neonatal nurses and midwives. So will my right honourable friend please update the House on the government's plans to build an NHS that's fit for the future, including by addressing staffing shortages?
Minister. Can I welcome him? And he makes an incredibly important point about this very stressful time, particularly for women in his area. We will listen to women and deliver evidence-based improvements to make maternity and neonatal services safer and more equitable for women and their babies, and we have committed to delivering that in the long-term workforce plan.
Victoria Collins.
Thank you, Mr Speaker. Local in my area, in the West Hertfordshire Teaching Hospital Trust, in 1 month alone, we lost 843 days to social care backlogs. That burden is often taken up by families and individuals to take that cost. And not only does that impact those, but the rest of our NHS healthcare. I welcome the talks about cross-party work together, but would the Ministry Secretary of State also consider greater support for unpaid carers, including paid carers' leave and a statutory guarantee of regular respite breaks?
I warmly welcome the honourable member to her place and also say to her that she's absolutely right to raise the plight of unpaid family carers. They are part of the team as far as this government is concerned. So as we set out our 10-year plan for social care, as part of our ambition to build the National Care Service, we will make sure that unpaid family carers are very much at the centre of our thinking, in no part thanks to her representations too.
Thank you very much, Mr Speaker. The Keep the Horton General campaign in my constituency has recently catalogued the poor experiences of tens of Banbury-based mothers who gave birth at the John Radcliffe Hospital in Oxford. Will the Secretary of State or a member of his team meet with me to discuss these concerning reports of poor maternity care?
Mr Speaker, of all of the issues that keep me up awake at night, maternity safety is top of the list. We've already heard about the staffing shortages and actions we will take to address that, but I also want to reassure people that as we build our 10-year plan for the NHS, patient voices, including those of recent and also expectant mothers, will be part of that process too.
Kit Malthouse.
During the election campaign, the Prime Minister came to Basingstoke on a visit and specifically promised to replace Basingstoke Hospital by 2030. Can we rely on this promise?
Well, I wouldn't rely on anything the former Prime Minister said. But, our Prime Minister. I thought he was talking about the former Prime Minister. Well, in that case, I can absolutely reassure the honourable gentleman that we will do. We are absolutely committed to the new hospitals programme. As I've already said, in terms of the budgets and the timescales, we will come forward with an honest appraisal of what we have inherited from the last government and what we will be able to deliver within reasonable timescales.
Matt Weston.
Thank you, Mr Speaker, and I congratulate the Secretary of State to his position. Yesterday's NHS data showed that we have the highest, or one of the highest incidents of dementia in the world. We have something like 500,000 cases just in England. I appreciate it's early days, 16 days in, but does the Minister give any idea why that may be and what can be done about it?
Minister.
Well, I thank the honourable gentleman for that question and welcome him to his place. It's an issue that it's personal for me, and I'm sure it is for many, many others across this House. A number of potential new disease-modifying drugs for Alzheimer's are in the pipeline, including lecanemab and donanemab. We are committed to ensuring that clinically and cost-effective medicines reach patients in a timely, safe way. The National Institute for Health and Care Excellence is appraising lecanemab and donanemab to determine if they will be made available in the NHS.
Nearly 10 children a month die of brain tumours. It's an issue I know that the Public Health Minister takes seriously. He was familiar with the work of the brain tumour charity Headsmart campaign. Would he agree to meet me and my fierce campaigner constituent Sasha Langton-Gilkes, who lost her son to a brain tumour, to discuss how NHS England could be persuaded to do more to persuade and inform and educate parents to identify the symptoms, so that collectively we can reduce these numbers of deaths?
Minister.
I'm very grateful for that question. He knows that I met with his constituents when I was the shadow Public Health Minister, and I can confirm to him I'm more than happy to meet him and his constituents now I've dropped the shadow.
Dan Tomlinson.
Mr Speaker, thank you. I'm sure the whole House will want to celebrate that the NHS is safe in Labour hands once again. And specifically in the Royal Free Trust area, which covers the community that I now have the honour of being the MP for, Chipping Barnet in North London, there are 100,000 people on the NHS waiting list. So what steps will the Minister take to reduce the waiting lists in places like mine, so we can see more people getting the treatment and the support that they need from the NHS?
I'm delighted to welcome my honourable friend to his place, and personally grateful to the Royal Free Hospital for saving my life when I went through kidney cancer. NHS waiting lists stand at 7.6 million, which was still rising as this government took office. Our 40,000 extra appointments, scans and procedures, and doubling the number of diagnostic scanners will make a real difference to getting that backlog down to where it should be.
Lee Anderson.
Thank you, Mr Speaker. Now, during the general election campaign, the Health Secretary visited Kingsmill Hospital in Ashfield, and I'm sure that helped me get re-elected. But Kingsmill was built on a PFI deal by the last Labour government, and it's going to cost £3 billion for a £300 million hospital. Would the Secretary of State now please assure me and the people of Ashfield that this will never happen again?
Can I say to the honourable member, despite my best efforts, he is back. I congratulate him through gritted teeth. And let me just say, I'm very impressed by what I saw at the Kingsmill Hospital. I'm really proud of the record of the last Labour government. It delivered the shortest waiting times, the highest patient satisfaction in history. And as I said during the election campaign, we will build on that success and also learn from some of our shortcomings too.
Danny Beales.
Mr Speaker, and I welcome the honesty and the urgency about a review to the new Build Hospitals programme. Residents in Uxbridge and South Ruislip are sick and tired of 14 years of broken promises about a new hospital. Board minutes have revealed that no business case was agreed at the last government, no funding released for a new hospital, and not a brick has been laid. Does my right honourable friend agree with me that urgent investment is needed at Hillingdon Hospital? And will he come back a year later to visit the hospital, visit staff and discuss their plans?
Can I welcome my honourable friend to his place? Better late than never, as they say. I have been to Hillingdon Hospital, amazing staff, appalling buildings. That's why the people of Hillingdon and actually right across the country deserve honesty, clarity, certainty about the new hospitals programme. This government will provide it and stick to it.
Mr McVeigh.
Thank you, Mr Speaker. Does the Secretary of State agree that handing over powers to the World Health Organization, which would undermine the UK's ability to make their own sovereign decisions, would be unacceptable?
Mr Speaker, the World Health Organization is an intergovernmental arrangement, and it is of vital importance that, of course, first and foremost, we work and only agree to things which are in our national interest. But we should not lose sight of the fact that in pursuit of our national interest, there are lots of things that we need to do together, from tackling antimicrobial resistance to preventing future pandemic threats, and that's exactly what we will do.
Marshall in Cordova.
Thank you, Mr Speaker, and can I congratulate and welcome the Secretary of State to his post. Eye healthcare services are in crisis due to the Tories breaking our NHS. Ophthalmology is the busiest outpatient service, making up nearly 10% of the entire waiting list. My national eye health strategy will seek to tackle some of these issues. So will the Secretary of State meet with me to discuss how we can tackle the eye healthcare emergency?
Mr Speaker, I'd be delighted to do that. And as she knows, during the election campaign, we visited Specsavers. There are lots of high street opticians that can make a real difference to cutting the backlog. They should have gone to Specsavers. Mr Speaker, this government will.
Final question, Wendy Chamberlain.
Thank you, Mr Speaker. My constituents have struggled to get pre-diagnosis ADHD and autism support for their young daughters. Now, we can't diagnose children at a very young age, but that doesn't mean families don't need help. Will the Minister confirm what engagement he's going to have with support organisations such as the National Autistic Society to ensure that best practice means that families aren't struggling for support?
Well, I thank the Honourable Lady and welcome her to her place, and it's an absolutely vital issue that she raises. We have got a plan for improving mental health services, 8,500 more mental health workers. Autism is, of course, a vitally important part of that, and I'd be more than happy to meet with her to discuss further how we might be able to take that forward.
Right, that completes questions. The